Hello everyone and welcome to another video. I am Dr.Vishwas J and in this video I will be talking about our skeletal system. More specifically, the classification of our bones. Our skeletal system consists of bones, joints, cartilages, tendons and ligaments. As an adult, we have around 206 bones present in our body. When we were younger and when we were born, there were more bones, but they eventually fuse together as we grow older. There are two basic types of bone tissues. First is a compact bone, which is homogeneous. Second is a spongy bone, which are small needle-like pieces of bone with many open spaces present in them. Our bones are classified by their shape and size. Based on that, we have total 5 types of bones. They are long bone, short bone, flat bone, irregular bone and sesamoid bones. Now let's talk about anatomy of long bones. First up we have diaphysis or shaft. It is composed of compact bones. It makes most of the bone's length. It is converted and protected by a fibrous connective tissue membrane called peritoneum. Next we have Sharpie's fibers. Hundreds of connective tissue fibers are called Sharpie's fiber. They secure the peritoneum to the underlying bone. Next we have epiphysis. It is ends of long bones. Each end consists of a thin layer of compact bone enclosing an area filled with spongy bones. Next we have articular cartilage. It covers the external surfaces of long bones. It provides a smooth, slippery surface that decrease friction at joint surfaces because they are glassy hyaline cartilages. Next we have epiphyseal line. In an adult bone, there is a thin line of bony tissue spamming the epiphysis and looks a bit different from rest of the bone is an epiphyseal line. Next we have epiphyseal plate. Epiphyseal line is a remnant of epiphyseal plate. It is seen in young and growing bones. It can cause the length growth of long bones, and by the end of puberty, epiphyseal plates are completely replaced by bones which leave only epiphyseal lines to mark their previous location. Next we have yellow marrow. In adults, the cavity of shaft is primarily a storage area for adipose tissue, either known as fats, and this area is called as yellow marrow or medullary cavity. Next we have red marrow. In infants, yellow marrow forms blood cells and red marrows, but in adults, red marrow is confined to the cavities in spongy bones of flat bones and epiphysis of long bones. And before I continue this video, I would like to tell you that if you are not subscribed to this channel, then please consider subscribing and hit the bell notification for latest update. There will be many study related and day-to-day health related videos uploaded on this channel. So please consider subscribing. It will be a great support from your side and motivation for me to keep making better and better videos. Now let's continue with the video. And next we talk about short bones. Short bones are generally cube shaped and contain mostly spongy bones, and their primary function is to provide support and stability with little or no movement. Examples of short bones are carpals and tarsals. Next we have flat bones. These are thin, flattened and usually curved bones. They have a thin layers of compact bone around the layer of spongy bones. Examples of flat bones are skull, ribs and sternum. Next we have irregular bones. As the name suggests, they have a irregular shape and they do not fit in any other type of bone classification. Example of irregular bones are vertebrae and hip. Next up we have sesamoid bones. Sesamoid bones are the bones that are embedded in tendons. These bones are small and round bones, and they are commonly found in tendons of our hands, knees and feet. Their function is to protect tendons from stress and wearing and tearing. The patella or the kneecap is an example of sesamoid bones. So next we talk about surface features of bones. Bones have site for attachment of muscles, tendons and ligament, and they also have passages for nerves and blood vessels. These are called bone marking. Bone markings are surfaces you can see in a bone that are not smooth but scarred with bumps, holes and ridges. There are two different types of bone marking. First is projection, second is depression. Projections are type of bone marking which grow out from the bone surface. Depressions are type of bone marking which are indentation in the bone surface. So guys, that's it for this video. Thank you very much for watching. Hope you enjoyed this video. Give your love and support by liking and subscribing to my channel if you haven't already, and I will see you in the next one. Till then, stay safe, be happy. Jai Hind.